What exactly is Parkinson's disease? It is a chronic and progressive neurodegenerative disorder that causes slowing in multiple body systems. For example, it messes with the initiation and execution of movement. Parkinson's disease also increases muscle tone, causes tremor at rest, and gait disturbances, all due to the lack of dopamine. Also, in Parkinson's, a specific area of the brain called substantia nigra is affected, causing a low dopamine level. On the slide, there's a picture so you can see where it's located. Also, with Parkinson's disease, all patients have very low dopamine levels. Pathophysiology of Parkinson's disease. Parkinson's disease is still not fully understood and still considered idiopathic, with ongoing research. Parkinson's is not considered hereditary but should be evaluated along with environmental factors. Fact is, 15% of Parkinson's disease patients have positive family history. Some genes involved usually are LRRK2, PARK2, PARK7, PINK1, and SNCA. Some risk factors that increase chances of getting Parkinson's are exposure to well water, pesticides, herbicides, industrial chemicals, rural residents, aging, damage to the brain, and free radicals. What is secondary Parkinson's? This type of Parkinson's happens after exposure to a variety of chemicals. Drug-induced Parkinson's is also secondary due to this type of therapy. Also can be seen used after illicit drugs. But with this type of Parkinson's disease, symptoms usually wear off after stopping the drug. Some other causes for Parkinson's disease are hydrocephalus, other neurodegenerative disorders, hypoparathyroidism, infections, stroke, tumor, and trauma. Development of the disease is due to the lack of dopamine because of degeneration of dopamine-producing neurons. Dopamine is important for normal functioning of body's motor system.
Clinical manifestations. The onset of Parkinson's disease is gradual and insidious with an ongoing progression. It's possible it could only involve part or whole of the body. Common signs and symptoms are recognized by the mnemonic TRAP. Tremors, usually the first sign that a patient notices as the onset of Parkinson's. It usually begins in a limb and could involve the hands or fingers in a pill rolling motion. Rigidity causes an increased resistance to passive motion when the limbs are being moved, causing a jerky movement. Sustained muscle rigidity will eventually cause pain and soreness in the head, upper body, spine, or legs. Akinesia, the loss or absence of control of voluntary muscle movements. This can be caused by chemical or physical alterations of the basal ganglia. Postural instability. Posture may become stooped or may have balance problem because of Parkinson's disease. Patients may complain of the inability to stop themselves from moving forward or backwards. A pull test is something that can be done by the doctor. Non-motor signs and symptoms. Depression, anxiety, apathy, fatigue, pain, urinary retention, constipation, erectile dysfunction, memory changes, and sleep problems. Labs diagnostics. With Parkinson's disease, there is no specific test, so diagnosis is based on the patient's history and clinical features. Clinical diagnosis requires the presence of TRAP signs. A positive response to anti-Parkinson's drugs are used to confirm the diagnosis. An MRI and CT can be used, but they do not diagnose Parkinson's. They can be used to identify tumors.
Treatments for Parkinson, medications, motor and non-motor, surgery, deep brain stimulation. Treatments for Parkinson's, motor, medications, dopamine replacement therapy, levodopa, carbidopa, example, Cinemet CR, Stalivo, Parcopa, Ritari, Duopa. They're absorbed in the intestine and converted in the brain to dopamine. They can be used as a pill or as a gel inserted directly in the stomach through a tube. Side effects: nausea, vomiting, drowsiness, low blood pressure, hallucinations, overtime dyskinesia. Avoid high protein diet. The decarboxylase inhibitor, lodocin, carbidopa, prevents the breakdown of levodopa in the body, so more levodopa gets to the brain and gets converted to dopamine. Helps prevent nausea and vomiting, usually combined with levodopa. The dopamine agonists, example, Mirapex, Mirapex CR, Pramipexole, Requip XL, Ropinirole, Nupro, Rotigotine, Apoquin, Apomorphine. They mimic the effects of dopamine in the brain, can be used alone or in conjunction with other meds, including levodopa and carbidopa. They're given as a pill, a patch, or an injection for rescue. Less dyskinesia, does not compete with dietary protein for absorption like levodopa does, but less effective for motor symptoms than levodopa. Side effects: nausea, low blood pressure, dizziness, sleep attacks, hallucinations, leg swelling, and skin discolorations. Livedo reticularis. The MAOB inhibitors, they decrease the normal activity of monoamine oxidase that breaks down the dopamine after it completes its activity in the brain, allowing dopamine to function for longer periods of time. It can be taken alone or with other meds like levodopa. Azilect is the only one that's okay for monotherapy for mild symptoms early in the disease. Later on, these drugs can decrease the need for levodopa requirements. The MAOB inhibitors. At higher dosage, Azilect reduces symptoms of fatigue and depression. The side effects are flu-like symptoms, joint pain, blood pressure changes, insomnia, hallucinations, falls, dyskinesia. That's for Xadago. You should avoid taking them with antidepressants, muscle relaxants, pain medications, herbal supplements such as St. John's wort, and with cough syrup, as it may cause serotonin syndrome, which is muscle rigidity, increased tremors, high BP, high HR, sweating, diarrhea, fever, and confusion. The COMT inhibitors, they prevent the breakdown of levodopa outside the brain, allowing more levodopa to convert to dopamine in the brain. Only administered with levodopa, not in monotherapy. It increases the time when symptoms are controlled, so it's prescribed when levodopa alone is not working any longer. The side effects are diarrhea, urine discoloration, liver damage, dyskinesia later on. The anticholinergic medications, they decrease levels of acetylcholine in the brain, restoring the balance between levels of acetylcholine and the dopamine. They can be used in monotherapy or with other drugs. It's good for controlling drooling, the tremors, and the dystonia. But the side effects are blurred vision, dry eyes and mouth, constipation, short-term memory loss, confusion, and hallucinations. The amantadine, that works on the dopamine and the glutamate brain chemical pathways. It's usually used in mid to late stage Parkinson's disease. Extended release treats the symptoms of dyskinesia. They can come in tablets, capsule, or liquid. The side effects are dizziness, low blood pressure, visual disturbances, hallucinations, leg swelling, and skin discolorations. Another treatment for Parkinson's is surgery, deep brain stimulation. Electrodes placed in the brain in areas that control movement. It's connected to a battery-operated device similar to a pacemaker placed under the skin below the collarbone. It delivers continuous electrical impulses that reduce the Parkinson's disease symptoms. It regulates the abnormal electrical signaling patterns in the brain. DBS works best to lessen the stiffness, the slowness, and the tremors, but it is less effective for imbalance and freezing. It may exacerbate cognitive problems, memory and concentrations, so it's not recommended for dementia patients. It will only improve symptoms for patients who respond well to medication. Always evaluate benefits and complications such as bleeding, stroke, and infection. You may still need drugs in combination with DBS. Older surgeries are not very common now. The pallidotomy, it destroys a small area at the base of the brain by heating it to 80 degrees Celsius. It can cause speech problems, depression, and worsening of symptoms. Thalamotomy. The thalamus is ablated by using liquid nitrogen. It will reduce tremors only. The complications are weakness, stroke, numbness around the mouth, drooling, seizures, impaired speech, and cognitive impairment. Complications of Parkinson's disease. Depression, compulsive behaviors such as gambling, hypersexuality, food addictions, compulsive shopping, drug abuse. The difficulty in swallowing can lead to choking, aspiration, and nutritional deficiency. Cognitive and memory issues, especially in those older than 60, thus increasing the risk for dementia. Sensory complications, loss of smell, visual disturbances, loss of color perception. Sleep issues, falling, staying asleep, daytime sleepiness, urinary incontinence and retention, constipation that could lead to fecal infection, and sexual dysfunction.
Parkinson's disease nursing diagnoses and interventions. Impaired physical mobility, self-care deficit, impaired verbal communication, impaired swallowing, risk for chronic constipation, risk for injury, ineffective coping, and imbalanced nutrition less than body requirements. Impaired physical mobility. Conduct a training program to increase muscle strength, encourage warm baths and massages, help client perform range of motion exercises, and encourage physiotherapy. Self-care deficit. Accessibility and rate of decline and scale of 0 to 4 to perform activities of daily living. Avoid anything that can't be done easily. Help client. Environmental modifications. Recommend occupational therapy. Impaired verbal communication. Refer to speech therapy. Teach facial exercises and breathing methods to correct volume, words, and intonation. Take a deep breath before speaking to increase volume and number of words in the sentence. Impaired swallowing. Assess the ability to swallow. Don't rely on gag reflex alone. Watch for aspiration. Refer to a speech pathologist for evaluation. Avoid straws. Allow adequate time for meals. Position head of the bed at 90 degrees. Add thickening agents to liquids. Keep client upright for 30 to 45 minutes after meals. Risk for chronic constipation. Increase fiber in diet. Increase fluids to 3 liters a day. Exercise and use stool softeners. Risk for injury. Make sure bed alarm is on and there's a fall mat. Assist with ambulation. Provide assistance devices such as walkers or wheelchairs. Assess home environment for clutter, slippery floors, and make sure there's a shower handlebar in the shower. Keep the call light within reach. Ineffective coping. Use active listening and encourage the patient to express his or her emotions. Refer the patient to counseling if necessary. Imbalanced nutrition, less than body requirements. Assess ideal body weight, encourage high calories and small frequent meals. Allow enough time for meals. Assess need for help during feedings. Refer to dietitian. And that's the end of our presentation. I hope you've enjoyed it. On the next page, we posted a video of the deep brain stimulation, but we realized when we made it into a movie that it won't play on here, but I left the link, so if you're interested, you could check out the link, and on our original PowerPoint, we have the video embedded. And that's all. Thank you.